Well, thank you for the opportunity to share some of the findings from this project. Today, I'm actually going to focus on the findings from the second and third papers of this project, looking primarily at outbreak roles and responsibilities, as well as some of the challenges and recommendations to support collaborative foodborne illness investigations. I am focusing on the roles and responsibilities of environmental public health professionals, collectively known as public health inspectors and environmental health officers. Despite this focus, I believe many of the findings and action items that will be discussed can apply to other professionals involved in outbreak response, including epidemiologists, laboratory scientists, public health nurses, managers, directors, etc. So the aim of the project, what I'm hoping to do with this and the three papers that are available on the National Collaborating Center for Environmental Health's website, is to raise awareness of issues that impact foodborne illness outbreak response, as well as to complement and raise awareness of existing outbreak tools, policies, and guidelines, and to examine foodborne outbreak focus and roles and responsibilities of environmental public health professionals. As the project developed, it was really clear that there's a lot of foodborne illness outbreak tools and guidelines already available. Some may say too many, but that's for a different discussion. So my aim was not to create yet another tool, but to shed some light on these existing tools, discuss some of the challenges related to them, and how we can help support collaborative foodborne illness investigations going forward. So a couple of key terms that I'll use throughout these presentations, and some of these terms can be used differently in different literature. So I wanted to highlight what I mean when I'm referring to them. So first being environmental public health professionals, so the broad term. So for this is a person working in the field profession of environmental public health who holds a certificate in public health inspection. The two most common terms I already mentioned would be as public health inspectors or environmental health officers, depending on where they tend to work across Canada. The other one is environmental assessment, which I'll go over in detail just to differentiate that from inspections. And the term emerging environmental public health professional, you'll notice as I go through the presentation, a number of the action items and recommendations and discussions that came out of this are focused a lot on emerging environmental public health professionals, identifying professional development needs for those who may not have as much experience in outbreaks. So the key messages, outbreaks are becoming more complex, requiring collaboration across disciplines and various authorities. Environmental public health professionals have a unique skill set that helps support outbreak response. There's a need for mentoring, practical experience, and training that's identified through this. Information silos and communication disruptions sort of within and between health authorities can often disrupt coordination of outbreaks. And one of the final things is a centralized repository of foodborne outbreak investigation resources could help support information sharing and improve collaborative investigations. So just some general background. We have an evolving landscape of foodborne illness outbreak. Responses often involve several organizations at multiple levels of government with complementary and sometimes overlapping responsibilities. We've seen an increasingly globalization of food sources and distribution, as well as new and emerging ways that food is brought to consumers, such as through e-commerce. That impacts the types of outbreaks, the identification of them, the trace back and trace forward associated. So these all pose lots of emerging challenges for foodborne illness outbreaks. So public health needs faster, streamlined, and more coordinated investigations to help address these. All right, so for this research that I did, a couple of points on the methodology. So there's two main parts that were involved. So the first was environmental scan, looking at Canadian public health websites, so scholarly articles, gray literature and government websites, search for information on foodborne outbreaks and responsibilities and competencies. Search strategies were adjusted for each platform. And So that sort of forms the background. And then a lot of the information I'm going to present today comes out of the surveys and key informant interviews that were completed. So I did complete 20 key informant interviews with a selection of public health professionals from federal, provincial, and local health authorities experienced in outbreaks. I used an initial survey that focused on clarifying outbreak roles and responsibilities and identifying some of the most common outbreak tools and resources that are available. And then the key informant interviews provided insight into the outbreak experiences and identified the themes and challenges that I will discuss today. So briefly, some of the key findings. Identified one way to look at outbreaks or to classify them as 4 different categories. So the local single jurisdiction, local multi-jurisdiction, interprovincial, and international. Through the survey and through the key informant interviews, there was general agreement on using these 4 categories just to help differentiate the different types of outbreaks, especially when it came to discussion of roles and responsibilities and experience and training needs for environmental public health professionals. So these types of categories could be used, going forward, again, just when it comes to identifying resources, as well as identifying training needs and experience. So to just shed some light on that, this is one example. So this is environmental public health professionals reported outbreak experience. So in the blue, we have their experience with international or the large scale outbreaks, and the green being the more local outbreaks. So you can see lots of experience when it comes to the local, smaller outbreaks, less experience for environmental public health professionals in the larger scale international outbreaks. And this same pattern was also observed when asking about specific outbreak roles and responsibilities. So one of the things that really came out of the key informant interviews, the surveys, was the uniqueness of environmental public health professionals when it comes to responding to and investigating foodborne illness outbreaks. So most participants highlighted the nature of environmental public health professionals' accredited education, practical training, and field experience, making them uniquely qualified to support outbreak investigations, as well as the fact that they're embedded in the community or in the boots on the ground. So that makes them critical to success. Other things that were identified for outbreak response requiring, the expertise in order to successfully investigate outbreaks requires general understanding and experience across these various disciplines, so microbiology, epidemiology, into lots of good feedback on communication and interviewing techniques as critical areas for focus and further training needs. So I already mentioned they're unique in their environmental public health focus. So just a couple quotes from the survey there for you, from the key informant interviews that highlight the importance of environmental public health professionals and their unique contributions to the field of public health. Oops, sorry. I jumped around here. Sorry about that. So I just wanted another point on this connection to the community. That was another strong theme that was identified throughout the key informant interviews. And several key informants also identified that these relationships were quite strained during the pandemic, and it's going to take some time to rebuild those. So just something to note there as well. All right, so for the rest of the presentation, I'm primarily going to focus on these 5 areas, which were identified as the challenges in current foodborne outbreak response. And you'll see seated throughout these several action items that are proposed to help address some of these concerns, continue to move the development and the response of outbreaks forward. So the list of action items, it's not exhaustive, but hopefully it's going to spur some discussion and continue to move collaborative investigations forward. All right, so let's dive into those. So the predominant theme that was identified came out through all the key informant interviews was that experience matters. Specifically, practical experience, professional development, and formal education. And it was really highlighted that emerging environmental public health professionals need training and mentoring. And participants also identified it's difficult often to get emerging environmental public health professionals. Experience in outbreaks due to the infrequency of outbreaks, especially those that work in smaller health authorities. Additionally, many of the outbreaks that we deal with in public health may not align with the timing of professional placements and practicums. So it's very difficult to for emerging environmental public health professionals to, really get exposure to those. So that's, again, the key informant interviews were identifying that emerging environmental public health professionals need to develop specific outbreak skills, including case and operator interviewing. Those were one of the areas that were identified. How to conduct guided interviews, how to get information out of people, continue to ask probing questions, all of those things, which are often quite different than the skills we would do in a routine inspection. Some of the comments from the key informant interviews is, getting comfortable living in the gray, helping to develop a dogged determination. And one of the key themes, sort of sub-themes that came out is recognizing that all investigators, everybody working on foodborne illness outbreaks, including environmental public health professionals, need to accept the fact that they're going to need to ask for help, right? That is not a sign of weakness. That was a clear message that came out through through the key informant interviews, is that ability to ask for help, right? Seek expertise in different areas, ask for support from colleagues as well as other investigators. So that's those strong collaboration skills in order to work effectively in a multidisciplinary team. Just another quote there about the loss of organizational experience and memory that came out through the pandemic. So this is another strong theme. And again, this is another thing like the connection to the community that participants stress is going to take some time to recover from those losses. Environmental assessments. So many participants identified the need for enhanced training and understanding of environmental assessments that are undertaken during outbreak investigations and distinguishing them from compliance inspections. So unlike routine or compliance inspections that cover a range of potential food safety violations, outbreak environmental assessments focus on the factors contributing to the cause of the outbreak, right? They're much more retrospective, looking back, trying to figure out what could have happened, what might have went wrong. Requires a lot more. It does include the inspection practices, but requiring a lot more collecting of information, sample collection, and a lot of probing questions and guided interviews with owners and operators to try to get the full picture of what might have happened. And then that's just summarized there in that importance of environmental assessments from one of the quotes from one of the key informants. Pausing to give everybody a chance to read that. And then moving on, look a little bit at competencies in outbreak investigation. Lots of resources there and lots of good feedback from the participants in this study. So there are several foodborne illness outbreak investigation competencies that were identified in the literature and the key informant interviews. There is a comprehensive table that's provided from the competencies, of competencies from two of the main sources in the second paper in this series. So that's pulling competencies from a published article that looks at that is entitled Competencies for Environmental environmental health professionals who detect, investigate, and respond to foodborne illness outbreaks, as well as the Canadian Institute of Public Health Inspectors Continuing Professional Competencies Reference Guide. So the table that's provided in that paper is a combination of those two. Here, I've just focused on a list of the most cited competencies. So investigation, already talked about environmental assessments, those interview skills keep coming up, critical thinking, understanding control measures, progressive enforcement, as well as good note-taking. So now we get into sort of our first set of action items. So how can these competencies be used? So one way is for academia and public health authorities, health units to evaluate the readiness of staff. In the case of academia, evaluate the readiness of students to support foodborne outbreak investigations by measuring them against the various competencies. And these competencies as well can be used to develop targeted training materials to focus on any areas of improvement or deficiencies that might be identified. Another big thing that came out is, or theme that was identified, is sharing of lessons learned. So participants identified the need to explore opportunities to share experiences in outbreak response, especially at the local level. There's lots of outbreak summaries. Like we do collectively a really good job of sharing outbreak summaries and lessons learned for those interprovincial and those international type outbreaks, those larger outbreaks that are often led by Public Health Agency of Canada. Those often get published and things like that. What many times is missing is the sharing of the learned experiences, the lessons learned for those smaller local type outbreaks. And what came out of the key informant interviews is often environmental public health professionals, were asking for, they weren't allocated time and resources to actually, take the time to develop those outbreak summaries and then share them, within staff and then even with outside of the health unit as much as possible. So I think everybody recognized that sharing lessons learned is a valuable part of routine outbreak response. It also represents an opportunity to highlight the amazing work of public health and allow us to step out from behind the scenes where we do often, we do most of our work and it often goes unnoticed. So this is a great opportunity to highlight, what environmental public health and public health in general does to protect the health of Canadians. And another thing that was noted is, as much as possible, outbreak summaries should be publicly available, again, helping to raise that awareness of the importance of foodborne disease outbreaks and the preventative measures that are taken. And then these outbreak summaries can then be used by health authorities and, again, academia to improve outbreak response, develop training materials, and again, just to highlight the important role of public health in protecting the health of Canadians. So a couple actions here. So to facilitate effective data sharing and to help this, there needs to be good templates, standard tools should be developed in advance. And this is, recognizing that many, if not all, health units have internal outbreak response policies and tools and guidelines. So that was clearly identified in the key informant interviews. Some of the challenges are when dealing with those interprovincial, international, even dealing with a neighboring health unit in an outbreak investigation. Oftentimes, the various tools or the guidelines may differ, which makes that collaboration more difficult. So participants recognize the need for increased standardization. One of the things, or what I should say, one of the most interesting findings for me from the key informant interviews was the lack of awareness and use of the National Collaborating Center's outbreak toolkit. So there was limited knowledge of it. Most people relying on internal mechanisms, internal policies and procedures, are not aware of it until the link was shared. So that's what spurs sort of action two there is, consideration for Public Health Agency of Canada to, survey public health authorities, identify ways to increase awareness of the use of the toolkit, as well as any additional training needs. Sort of continuing on that, this opportunity to share those lessons learned. So there's lots of different ways that can be done. Ideally, these outbreak summaries and sharing of lessons learned would include information on the most notable successes and challenges that occurred during an outbreak response, as well as what could be improved upon for the future. So some of the ways that can be done: establishment of communities of practice, use of things like this, like webinars, conferences, curated list of outbreak summaries and blog posts, and I just break those down a little further. So we look at conferences and share lessons learned and professional development opportunities. Public health related conferences could actually, consider adding a stream to future conferences where they can share those lessons learned, so share outbreak summaries. And this wouldn't have to just be foodborne illness outbreak summaries. These could be, infection prevention and control related, like anything, right? So zoonotic diseases, but just, having those opportunities where people can submit calls for abstract and help share their lessons learned, share their unique stories, how the investigation went and areas for improvement going forward. Other things that were sort of brought up through the key informant interviews, potential to create a blog site similar to what is done by the University of Guelph with their worms and germs website to share, small stories, outbreaks, even if they're, redacted type outbreaks, they're just highlighting, what was found and the key lessons learned. And then all of these, again, could be used by health authorities and academia to develop training materials. So just further into outbreak resources and some emerging trends. So I mentioned already that lack of awareness of some of the tools that came out of the key informant interviews. And one of the things, a couple of key informant interviews, I've got the one quote there, identified an interest in having access to more standardized and easily accessible resources, trying to house them in one particular spot would help. So they gave the example of, in their province, all of the COVID pandemic related information, resources, tools were all available on one website, right? So they clicked through the various links. It was easy to find. They knew where to go to find new information. They knew where to go to see if any information had been updated. So I thought that was a really good point. So the question then becomes, how do we come to agreement on which resources to use and where to house them? That's definitely a challenge. Some examples of some of the most common outbreak tools that were identified, again, through the literature and through the key informant interviews: the National Covering Center's Outbreak Toolkit. Public Health Agency's Outbreak Management Division also offers case interviewing and enteric illness outbreak investigation training for schools and public health authorities upon request. So there's lots of training opportunities. And then there's lots of other resources available, online training. There's lots of good resources available for conducting interviews, conducting environmental assessments, things like that are available for people. So, again, part of the point here today is to try to raise awareness of some of those. Another thing that came up that's sort of changing the landscape of foodborne illness is the access to data and the amount of data that we now can collect and do collect during outbreak investigations. So this represents a tremendous opportunity for the identification of outbreaks, source attribution, trace back, all of those things. But it does also represent an increased workload for the analysis, right? Just sorting through the information, finding the information, collecting it, all of that. And there is the potential, as our identification tools increase, our ability to identify outbreaks and link cases. So to link individual cases that may not get the scrutiny as we start to connect those to potential sources, leading to outbreak investigations, that's also going to increase workload, right? So it is definitely something that has to be noted, right? As technology improves, as our ability to track data, identify potential outbreaks improves, it's excellent. It should hopefully reduce the amount of cases. We can respond earlier, but that response costs resources, right? So it's just something to keep a note. Some of those data sources, so there's lots of emerging, whole genomic sequencing, metagenomic data now available. There's becoming data available from industry biosensors, and then lots of consumer data, right? So there's been lots of literature published on the use of the consumer-related data, loyalty cards, the ability to help trace back sources of potential contamination. So one of the things that I did create or identify through this project was the potential use of a RACI chart. So this comes from project management. Some of you may be familiar with it or seen something similar to it. So use findings from this project to create a RACI chart, which stands for responsible, accountable, consulted, and informed. And it's a responsibility matrix template that can be adapted to a specific outbreak and response for various organizations. So you can adapt this tool for local all the way up to international. It's organized by the three main aspects of an outbreak investigation, being environmental, epidemiological, and laboratory investigation pieces. And it also includes post-outbreak activities, includes debriefs and lessons learned. And basically the way you would use a RACI chart is for each task in the outbreak, you're going to designate who is responsible for it. So each task will have someone, at least one person who's responsible for doing the actual task. And then this differentiation here, a big piece is the accountability. So that's who's ensuring that those that are responsible know their expectations, that they're completing the work, that they're submitting results in a timely manner. And when it comes to tasks, there should only be one individual accountable for it. So one key checkpoint there. And then it also adds in, and this was in conversations with the key informant interviews, people really sort of resonated with these two groups, which are sometimes forgotten when doing outbreak investigations, and those that are consulted. So people who need to provide input on the work being done on a task, they have a stake in the outcomes, but they may not be, doing the direct investigation, as well as keeping other people informed. So who needs to be informed of what's happening in the outbreak, what's happening when it comes to recommendations. So they don't need to be directly involved in the day-to-day outbreak, but they may need to be informed about key steps or key components in the outbreak as it develops. So that's just a picture of part of the RACI chart and what it looks like. So going back to one of the key pieces that I started in the beginning, looking at coordination of outbreak resources. So how can we do that? Key informant interviews, identified this need for that. So a couple options we could look at. Is this something that Sci-Fi National could do on the website to just curate that list of recognized foodborne illness outbreak resources, or something for the National Collaborating Center to do? These were sort of the two that were identified early on as potential easy targets to help with that coordination. And again, ensuring that public health schools and accredited institutions then incorporate these resources into their curricula to develop knowledge and foodborne outbreak investigation skills for emerging environmental public health professionals. Mentioned some of the issues with collaboration challenges really early on. So just to sort of close that off, investigation of outbreaks must be collaborative because they're complex, requiring a variety of professional skills and strengths. There are some challenges when it comes to communication that we've already talked about, data collection, standardization of tools, and information sharing that can sometimes hamper the collaborative approach. Even at the local level, the structure of the health unit, the delivery of programs was identified by participants here, whether it was general program or specialized. A lot of different feedback and variation there, depending on the way that a program is structured, as to the level of experience and comfort that people had in various roles and responsibilities for outbreak response. And my last of my 5 is professional development needs. So sort of a bit of a summary here. So what do environmental public health professionals, especially emerging environmental public health professionals, need? They need a strong food safety foundation, keen awareness of emerging food safety trends, how to conduct environmental assessment, and getting that experience, right? There isn't a replacement. They're not going to get it all in schooling, attending webinars or anything like that. A lot of this is going to come from mentored experience, working through outbreaks with knowledgeable colleagues. So some action items, incorporating more foodborne outbreak learning opportunities, including case studies and simulations into schools, as well as field training. I mentioned earlier, again, so just summarizing that, incorporating those competencies into the curricula of all public health programs, and really focusing training needs on interview skills, use of standardized interview tools, and strategies to address cultural and language barriers too, right? So ways that we can break down some of those barriers that exist. Employer opportunities. So students would benefit from increased exposure to outbreak investigation, getting that hands-on experience. So public health authorities trying to provide as much of that experience as possible, given the limitations we've already talked about. If you're in an area where outbreaks are scarce, looking at opportunities to provide mock outbreak simulations as discussed above, having students complete outbreak training modules online, things like that, just to further their development. And participants also noted examples of provincial and federal agencies facilitating training to support environmental public health professionals in outbreak response, including understanding of laboratory techniques and developing tools related to specific commodities. So one of the big examples of that is the BC Centre for Disease Control, creating a flow chart to assist in assessment of seafood-related illness by symptoms for Vibrio infection the Vibrio infection in case report form. So there's lots of great examples of various partners, provincial and federal partners, responding to training needs as it relates to foodborne outbreak investigations, developing tools, and then delivering training to local public health so that they can use that. Other things, there's opportunities. You could look at developing an annual foodborne outbreak challenge. So University of Colorado has an integrated food safety center of excellence, and they actually run a foodborne outbreak challenge for students every couple of years. It's a competition that students can compete in. So that's something as an interesting opportunity to, again, improve skills, have a little bit of fun with that, and also integrate between the field and academia as well. And then last couple of things. So limitations, just from the research conducted here. So qualitative research methods used are not intended to be fully generalizable. Participants in this study may not represent all environmental public health professionals or public health authorities across Canada, recognizing there's lots of variation within provinces, across provinces, even within health units, and how programs are delivered, how foodborne illness cases and outbreaks are investigated. So it's just doing the best that we can to highlight those challenges, and they may be applicable to you and some may not be applicable to you. As well, the environmental scan used in the study did not include a review of public health authorities' internal foodborne illness documents or policies. It was focused on what was publicly available. I already talked about the variation. So then last, in summary, environmental public health professionals are critical to successful outbreak response, given their unique environmental public health focus and the fact they're embedded in local communities and their keen understanding of food safety and source attribution. Experience matters, especially with environmental assessments and interviews. And this is highlighted by the recent loss of expertise in many health authorities due to staff turnover linked to retirements, as well as people leaving the field or being redirected to COVID response. So there was a lot of individuals that identified within their health units a loss of that organizational memory when it came to foodborne illness investigation. And last, that need to explore opportunities to share experiences in outbreak response and lessons learned so that we can enhance professional development, improve outbreak response, and increase awareness of foodborne illness outbreaks and their impacts. And to highlight the amazing job that environmental public health professionals and public health in general do when it comes to responding to foodborne illness outbreaks. And thank you for your time, and I will open it up to questions.